subscribe, click the notification button. Join the Look Up TV movement now.
Now, 1, 2, 3, and now the fourth wave seems to be knocking, still in the process of coming to terms of what became of our lives, picking and piecing the pieces that the pandemic scattered together, trying to get our lives together. Then boom, another variant, deadly, and one that is reported to be spreading like wildfire. The Delta variant is here, a variant that is said to be so adamant in infecting people that our efforts now seem to be not enough. How prepared are we for a variant that is taking us back to the drawing board? Now tonight on Counties in Focus, we look at the counties and countries' preparation in dealing with the Delta variant, the frontline workers, safety, and who are on the clock to restore the health of their patients while facing this monster face-to-face. Are they equipped enough? And also, do vaccines still have the magic effect on this variant, or are we about to face another doom? This is Counties in Focus. My name is Brian Amuai. In studio, I have George Gibore, who is the Secretary General, Kenya Union of Clinical Officers, and joining me via Skype is Njoki Fernandez, CEO, Kenya Medical Association. Ladies and gentlemen, thank you so much for making time for us to have this discussion about this pandemic and what effects it has on frontline workers and just the country as a whole. Thank you so much. Njoki Fernandez, I'll start with you. We are reporting a variant that is being reported to be very deadly. How prepared are we as a country to face this one right now?
Good evening, and thank you very much for the question and for the invitation to have this very pertinent conversation. As a country, we have deployed, I believe, to the maximum because we have been facing this wave since last year. So we have been at it and we have been running as far as the healthcare systems have been concerned, and we are working all out. Yeah, we have deployed our healthcare facilities to the maximum, our healthcare workers, and everything we have. But we're still reinventing ourselves every day to find ways of still coping better with the emerging problems as they arise. And also we're at an advantage now because we have lessons that we have learned that were not there as the pandemic started. So we are doing the best we can under the circumstances. Of course, we still need to do more because, again, we find a situation where our resources are stretched to capacity, and we are still not able to adequately manage, especially critical care, medication, PPEs, human resource. But I believe we're doing really, the health systems are really trying their best to cope with this pandemic and this situation.
Okay, so I'll come to you, Gibore, George. We have had the first, the second, and the third wave. We are probably facing a fourth wave right now. We've not yet confirmed. People are saying it is a looming wave. It's a looming fourth wave. Njoki has just commented on how prepared we are because we've been preparing ever since the first wave. What we did in the past, or rather in preparation for the first wave, actually enough to take us through this fourth wave, assuming we have a fourth wave?
Thank you, Brian, for having me in this very important forum. That is a very important question. We are doing more than close to 2 years after the first case that we received in the country. And where we were is that the first time, no one knew what was to happen, even what to do. We had to learn. We have been learning. Where we are, if we are asked today, when we started and how we started and where we are, whether we are still moving forward, I need to say that it came a time probably where we dropped the gun. And of course, what I mean is that there were some measures that we put in place, especially when we got the pandemic, including hiring more healthcare workers, who were put on contract in different terms, 1 year, 6 months, 3 years. Unfortunately, for the 6 months, 1 year, their term ended. There have not been any communication from the government. That's to mean we employed these people to fill the gap. But sometimes we realize, okay, we can do without you. They are forgotten without any communication. Those that have been left to at work, they are actually overworked. Because by then we evaluated and realized that we didn't have enough staffing. And going by the staffing norms that we have in the country, actually recommendation of the WHO is clearly adopted in the country, is that we are not even doing a third of what we are recommended. For instance, I can give a good example for clinical officer. We are supposed to be now around 18,000 in the government, but we only have less than 7,000. So if you look at the percentage, we are doing so low. The other thing is that the country, in terms of fighting the pandemic like this, is about building capacity in every aspect, like testing capacity. We announced in the country that we can do 30,000 per day. We still do less than 7,000 most of the time. And we have never grown beyond that. So to some extent, what we do does not reflect the clear picture. And even some of the counties do not do any test whatsoever, giving a wrong implication and a wrong perception on what we have. When we started, we came up with measures. Policies were developed that was to assist. Once they are implemented, then we get a clear picture on how we are moving and how preparedness we are. Now, we do not do contact tracing anymore. We dropped the guard because previously, when you test positive, I will take the contact people, your family, your workmate, and probably any people that you have come across. Then we notify them, we bring them, test them. This is no longer happening. So how prepared are we? The picture we see being displayed, I think some time back, the government came up with measures building capacity in terms of bed capacity, ICU bed capacity. To this extent, a majority of the county do not have the beds capacity. They never grew their bed capacity. I saw yesterday that we have close to 190 patients in ICU, but they are saying they are full. So do we only have 190? I have several clients who are calling to assist get the bed, but we can't get a bed in the government facility. So what does it imply? Are we prepared or are we ill-prepared? To some extent, I go back to the term I used that we dropped the guard and probably we wait and see. Now you ask whether we are doing the fourth wave. If you go in the government probably information on their website and even anywhere, including a ministry, they announced that they predicted to have this wave. The model that came up through the researcher, they demonstrated that we were to have this we were to have a fourth wave by this time. So for us, we hold that we are doing the fourth wave. And of course, by evidence that we have a new variant, quite infectious, and of course, having stretched our capacity, we cannot admit anymore, including the main county, which is Nairobi, cannot admit anymore. We are doing a fourth wave, and we must be able to take it seriously. And why the government must announce this is because when you announce that we are in another wave, you take stringent measures. The government is avoiding to go there because of the noise that comes from the public. And this is a serious thing because we are losing very many patients. And a number of them are actually losing life without any being tested. Okay.
Yeah. I think, let me throw this to Njoki. Njoki, George says we dropped the guard along the way. We stopped being careful. Measures that were put in place, some of us were very reluctant. And the government at times did not enforce when it comes to just making sure that this does not spread further. Why did we, from where you sit, why do you think we dropped the guard? Did we become reluctant because the numbers were down? What happened?
Behavior, we something and then time we get tired. Then people go back to their usual way of life, not realizing that with COVID, we are in for the long haul. We're here for a long time. And so we cannot drop the measures that we were very stringent about at the beginning. And we realized that obviously when people went back to work and went back to school and went back to their normal activities, life moved on and we all became a bit careless. If you look at all of us, we can examine ourselves and see over the weekend, we are always having gatherings, we're always having meetings, we're going for funerals, we're going for weddings, we're going for all manner of social, political gatherings, you see. So the initial fear and the concern that we had actually just has gone down, and it's a pity. Understood, because we are human and we get tired, but also this is where now the problem is. And then also, again, like George is saying, we are in for the long haul. So we cannot reduce the measures that we had put in initially. So the staff that we had employed, the facilities that we had utilized, the amount of energy that we had put into managing COVID-19, it's something that we have to keep up. And that is what the fourth wave is showing us, that the minute we let our guard down, then we're hit again. That's what happened the first time, the second time, the third time. And unfortunately, we are also affected by the international community, because these variants come from outside the country. They don't come from locally. So the Delta variant has come, and I read somewhere about another Gamma variant that is somewhere has been detected in South America. So this is going to be a continuous process. It's going to be continuous, and we have to really keep on our toes, keep on our feet, keep talking about the preparedness, because it's not going anywhere anytime soon. We have to learn how to live with COVID-19 and look after ourselves as much as possible. And at this point, I really want to talk about the personal responsibility that each one of us needs to have, because ultimately, I'm the one who chooses to go to that function. I'm the one who chooses to go to that party. I'm the one who chooses to go to that event. How do I conduct myself when I'm there? The masking, the social distancing, and things like that. And then now we come and spread the virus amongst ourselves. So ultimately, because life must go on, yes, businesses must continue, our economic activities must go on, we really have to, each one of us, be responsible. Because you see, then when you're sick and then you come to the hospital, and then the health sector is facing all these challenges that George has talked about, then you see we might not look after you as well as we would want to. So the best thing is really just to look after yourself and take care of yourself.
So you want to add something?
Let me add to what Njoki is saying, and it's very essential, that we are a very interesting country, quite reactionary. We wait and see. Now, I talked about predicting. When you predict, like now, if we declare this the fourth wave, we need to decide and say we are likely to have the next wave by this time. Now, Njoki says very rightly that we need to learn how to stay with this disease, ensure that the families and activities are going very well, are going on well without interruption. But let me say this. I talk about reactionally because the leaders call us into order, tell you, ensure you have your mask, avoid going to meeting, unnecessary meeting, avoid doing 1, 2, 3. So who is the first person to hold meetings? Is the government officials? Are the politicians with bad manners? And I say it vehemently because the president had a meeting in Nyanza sometime. It's a national holiday, yes, but you know what happened. Thereafter, what happened? Every weekend, meetings, both the opposition and the government holding meeting, including ministers, in the names of agriculture, in the names of health. Now, when we talk about this, any other Kenyans who still doubt whether we have COVID, they actually, you make it difficult for them to believe we have COVID. Because if you tell me to keep the mask and you appear in public meetings, rallies, big rallies, not small rallies, without a mask. None of the people in the congregation has a mask. So what are you telling Kenyans? Then tomorrow they are the same person to come and tell me, do 1, 2, 3. You inform us. We are opening school. We are going to ensure that your children are keeping social distancing. We will provide masks. Every teachers will be tested before they go to handle your children. It never happens. We are in contemptuous. We are acting in contention that we don't trust what we tell the public. This is the bad manners I'm calling out. That we, even the healthcare worker, we find it so difficult to tell people, believe you need to ensure you have your mask once you're in a social place, clean your hands, avoid touching unnecessary services. This becomes so difficult because the people who appear in our media every time making news are doing the verse. Then when you look at it, that the projection we do, we need to do 1, 2, 3, like we are supposed to do the vaccination. How do we actually ensure that the vaccination drive is going on very well? Policy making are done in boardroom. When they come to execution, become a problem because the people who are supposed to execute these policies are not involved. So it become a problem. You tell us you don't have enough staff. You ask me not to go to meeting, but when you want to do vaccination, you ask me to travel 50 kilometers for a vaccination. A cost you are actually taking back to me. And again, when I come there, we are more than 100 waiting to be vaccinated. Is it not a congregation? So these are some of the measures we need to do. And even when now we discuss what is it that we need to do differently for us to avoid this spiking and the infection that are actually raising in the country each and every time, and to some extent, including the government trying to say that we are still doing the third wave. Then even actually if it is the third wave, it is a big worry because you cannot have a prolonged one that we never even ensure that we are following our stringent measures to ensure that we flatten the curve for the third wave. Then it is a big worry. If at all we continue holding that we still have a third wave and no measures were taken, we dropped the guard on the way and we let the virus to spread. Like you closed down the 13 county in the Nyanza region, you allow them the daytime to travel to Nairobi, spreading the same virus you said, because they said the Indian virus, that is the Delta virus, was only in the other side. But now it's all over. It is the most virus variant in the country currently.
Okay. Now, Lisa, Joke, I want to bring you on this one. George mentioned that sometimes it becomes a little bit hard for the health workers to convince the public that the virus is real. And he mentions that measures that we've put in place to contain the virus. For example, we are having a dusk to dawn curfew, but people are traveling during the day. Is it really working in terms of just trying to contain this virus?
You know, ultimately, like I say, Kenyans we're an interesting people because we do our best to try and go against whatever has been set up by the guidelines. And I think these guidelines are informed by science and a lot of common sense. So we want to try and defy whatever it is we are told, you know, for the sake of, I don't know, what we are trying to prove. So it's true that I think the common sense should dictate that travel if you must. Whether you're traveling during the day or whether you're traveling during the night, the point is, if you must go, then you go. If you don't have to, then stay at home. Yeah. So, and that is what we need to start telling ourselves as a nation. We need to just stay put. We saw the other day what George is talking about. We had a big event, the Safari Rally that was recent in Naivasha, and the whole of Nairobi relocated to Naivasha. It was during the curfew, so no one was traveling at night, but we were all there. It would be interesting to see the data on how many people got infected in that event in Naivasha. Yeah, the rallies that we're talking about, the gatherings that we see, you know. So I don't think we understand that ultimately we really have to be the ones. And I think, truth be told, there's a lot of information right now. So we just have to be responsible for ourselves and for our families. And then there's another thing that George has mentioned, the issue of vaccination. We've seen countries where the vaccination has been successful. They've gone back to their lives as usual. They're not wearing their mask and life is moving on. Of course, they get spikes of infection here and there, but by and large, they've gone back to their life as normal. We know that there is vaccine inadequacy. We know that we're a disadvantaged third world country, so vaccines will always be a challenge. But when the vaccines are availed, like now we got a consignment of 400,000 vaccines over the weekend, AstraZeneca. What is our response as the public? Yeah, they're giving the first and the second dose. Are we availing ourselves for vaccination, or are we still giving conspiracy theories? We love doing that on social media, spreading all manner of messages and confusing people who then don't avail themselves of vaccines. And sometimes you hear they even expire, which is a very big pity. Yeah. So, like I say, we are a nation that really needs to wake up to our responsibilities and wake up to our realities, and not always, as much as it's true, government is going to try and the medical people are going to try very much to look after us. I have now firmly of the opinion that we need to stop presenting ourselves to the healthcare facilities in the first place. And how do we do that? By looking after ourselves, by all the protocols that we have been told. Then that way the burden reduces on everyone. And when the vaccines are provided and you can go for vaccination, please just go for vaccination. And this helps everybody, I think.
Okay, now talking about the burden, because I think the healthcare workers or frontline workers bear the burden of it all. How stretched are our healthcare workers when it comes to this? You people deal directly with them. How stretched are they when it just comes to dealing with this pandemic and having people streaming to hospitals? We are being told there's lack of oxygen in some of the hospitals. There are no ICU beds and all that. If I start with you,
okay. Okay. Sorry. Yes. So you see, the thing is that the resources that we have are what they are. So the ICU beds that we have managed to procure are limited. The oxygen is a consumable, so it gets finished. Yeah. The medication also gets finished. And remember that we are in a global pandemic. So some of these resources, especially the ones that we have to import, have a shortage globally. Yeah. The medication, the vaccines, etc. And then we find that the human resource, like George said, there are those who are hired initially and then their contracts were not extended. So there is that gap in the human resource in looking after COVID-19, especially in the public facilities. And then those who are there are tired, because they're working very long shifts, and they're also concerned about their health and their safety. You see, so you're dealing with a medical fraternity that is also, feeling the heat of this thing, and they also need to be supported, because if you do not support the medical facility and the medical personnel, then who will look after you when you present yourself to a hospital? So it is a crisis that needs to be looked at. We need to look at personnel. We need to boost them. We need to pay them well. We saw in some places where the medical personnel hadn't been paid for all the time they were contracted. Since COVID began, they have been working. This is really unfortunate. And there is money. I believe there is adequate funds to look after the people who look after you when you present yourself to hospital. So really, I think this is something that needs to be given priority, and let us get more people on board, so that then we ease the pressure on the current medical personnel that we have, and also to think that this is going to be a long-term thing. So even as we are budgeting and as we are planning, let's not budget for 6 months, because COVID-19 is going to be here for some time, until we are all adequately vaccinated and we all have that herd immunity. So it's going to be a 4th wave, and a 5th wave, and a 6th wave. So we cannot be reactionary, as George is saying. We need to be proactive. Now we have enough data to predict, and we have enough data to prepare.
Now, before I take my first break here, George, I just want to bring you on this one. Joaquin mentions when it comes to just how stretched the medical fraternity is, and our doctors and our healthcare workers, all frontline workers. We are not. What do we need to do to be taking care of them during this pandemic?
Thank you, Brian. First thing first, we have limited resources, starting from human resources to the number of beds that we can offer you when you are so serious, you are very serious. Now, Why we are losing many patients? Because the ultimate treatment for any patient who is COVID probably affected is oxygen. Okay. Now, at a moment you delay to give a patient the oxygen when they so need it, if you delay for some time, the damage continue to grow and we lose this patient. Okay. And that is why, I can say, I'm very sorry to say this, that on Friday and Saturday, I was approached to assist 2 patients by virtue of my colleagues knowing that we tried to get a bed for these people. One of them, it took 48 hours to get a bed in Kenyatta, but later on the patient died because when he was being admitted, already the damage had been it was intense. And this was just a 42-year-old person. We lost another grandma of 92 years. I was called on Saturday. The patient was tested in Bagadi. They didn't have any bed. They released the patient home, despite that the oxygen saturation, the SpO2, was saturating less than 70, actually 69. They went home without the knowledge. Later on, they called now a relative, I believe mjuku wake, who works in Nakuru, and she called me. Her sisters get a bed. My grandma was tested yesterday, but I hear now she's complicated. She can't even speak. I asked them to go to the nearest hospital. The person who was there, they wanted an ambulance. We couldn't get an ambulance. But later on, we said, let's find a bed where she can be able to be assisted to get oxygen. Mm-hmm. We didn't get. Unfortunately, we didn't get any bed in Nairobi, Kajiado, and Kiambu.
Those are 3 counties?
Yes. We got a bed in Nakuru. Now, we wanted an ambulance to take the patient there. NMS said we don't have a provision for us to transfer a patient outside the county. What is the alternative? We seek for an alternative. We got from Red Cross. They were asking 65,000 for patient to be taken to. The family could not afford. So we got from Nakuru nursing home. They were asking for 35,000. The family paid. Now, good enough, the colleague was to come to pick the grandma from Ongata Rongai in Nairobi. When they reached here, unfortunately, the grandma had died. These are 2 patients known. As we are talking, yesterday, I was called by one of our colleagues who is a public health officer. The patient was admitted, was in Ruai Hospital, was looking for a bed in the government. I advised them to seek outside the county after we lacked here. I think they had gotten a bed. I don't know whether they were managed to go to Murang'a. You can see how stretched the resources is. Then to add, I think, salt to this, when a patient is so sick, need more attention and need more specialty. So when you have less specialists to attend to all these patients that you admit, again, you don't do a service to this patient. Okay. So this is how serious the situation is. And until the government look at it, how intense the situation is, and focus to ensure that we are doing the right thing, then we are not likely to get it. Let me add this, that we need to be learning very fast, because there have been countries where they are where we are. Mm-hmm. Because like when we talk about already facility are stretched, mm-hmm. and some of the county without any single bed, okay. Then we are announcing that any other person who get seriously sick might not be able to get any assistance. We might lose those patients. And unfortunately, those are unhighlighted cases and might not get to to be known by the government. Hold it
right there. I think I'm up for a break. I'll be taking a short break. We'll be coming back to look at that, just how stretched the hospitals are in different counties. 3 counties, we are looking for just a bed for a patient. And also we'll be talking about this vaccines when we come from this break.
Welcome to the Natural Juicing Center. We are a unique organization that seeks to provide the community with an alternative healthcare option. We specialize in the use of a natural holistic system that focuses on building health through cleansing and nourishing of the body. We utilize a variety of natural health promoting methods in our services, which include juicing therapy, hydrotherapy, colon cleansing, massage therapy, and a comprehensive cleansing service, among others. Our juices are freshly made and tailored to each and every client's individual needs after evaluation by our team through our free consultation service. You can now book for any service or order for food supplements on our website www.naturaljuicingcenter.co.ke. You can also visit our center in Kahawa Sukari, house number 1334, Kahawa Sukari Avenue. Natural Juicing Center. Your health is your wealth.
I have to tweet about this.
What phone is this? Hey, looks good. How much is it?
You haven't heard of the Optiven offer?
No.
I must excuse you to invest too. Optiven has this amazing offer. If you make a commitment of 900k in any of their value-added projects, you get rewarded with a cool smartphone, bro.
Like, follow, subscribe, click the notification button. Join the Lookup TV movement now.
Thank you so much for staying with us here on Lookup TV. Counties in Focus. We are looking at COVID-19. The Delta variant is here, so they say, and just how stretched our hospitals are and the medical fraternity. My name is Brian Amoy. Once again, you can get in touch with us on our social media handles at Amoy Brian on Twitter at Lookup TV. In studio, I have George Gibore, who is the Secretary General, Kenya Nurses Association.
Kenya Union of Clinical Officers.
And also I have Njoki Fernandez, who is the CEO, Kenya Medical Association. Thank you so much for staying with us here. Now, before we went for a break, we are talking about just how stretched the hospitals are. And I think, Njoki, I'll come back to you. George mentioned something. Finding a bed, they had to move to 3 counties. How bad is this situation? 3 counties to just get 1 bed, and we are still continue to report cases day in, day out.
Yeah, it is what it is. The problem with COVID is that it's not like an obstetric thing, you know, where you come today, deliver the baby, and go home tomorrow. So COVID, especially severe COVID, requires hospitalization with high-level expertise and equipment, and for a long duration of time. And that is the problem. So you find someone is on a ventilator for 7 days, 8 days, 9 days, and this is one of the problems that we're having. So again, we have to think about prevention and reduction of the numbers actually getting to the hospital facility, because we have people, there are always requests. I'm getting phone calls all the time. Mm-hmm. Where can I get ICU bed? Where can I get oxygen? And sometimes the answer is there's nowhere. You know, it's actually sad that people will pass away because of not being able to get the help that they receive. And no country will have unlimited resources. We saw that even in the West. Now they seem to have contained the infection rate, but when we have the very high infection rates in the US and in Europe, and very recently in India, I mean, you saw India is a country that is advanced medically, but they were struggling. Yeah, and we had very many patients who are dying outside hospitals because the resources will always be limited, always. So how then can we manage the crisis so that we don't get to stretch these unlimited resources. And I always tell people, today it will be me, tomorrow it will be you looking for a bed, and we will suffer the same, the same struggle. The fact that I am the CEO of KMA, if I want a bed today, I will struggle like anybody else who requires to get an ICU bed for COVID. So, and then also to remember that when we have so much attention on COVID, there are other diseases in that are still, that still exist, other pathological conditions, and these then get to be neglected because all our attention is on COVID. And so what happens? You will find that people are also dying from other conditions that could have been managed, but these are the same ICU beds that we're using. So road traffic accidents and other conditions that usually require ICU care, then there's a problem there because we have switched all the attention to COVID. So then the general quality of healthcare in the country actually goes down because we are not managing COVID, and as a result, we're not managing the other general medical conditions in the country. So it is a concern. It's a concern that we really need to think about. And again, not to be reactionary. It's coming and it'll come again, and we'll get another wave and another one. So what do we do to make sure that the effects are not as severe as we are seeing now? Okay.
Now, your statement brings me to my next questions. Now, the hospitals are stretched. We don't have probably the resources to deal with that, and yet Mombasa County here yesterday just banned home-based care. So if hospitals are stretched and we are not allowing people to self-medicate at home, not in a bad way, but just when it comes to COVID-19, what do we do in that case? Why did the county government of Mombasa say now we are not going to be to allow home-based care because we are afraid the cases are rising and this might actually lead to more cases? George, to you.
A good question there. And of course, first I need to address the issue why we introduced the home-based care. The home-based care came to address the issues of already stretched resources, and that is the health facilities, more specifically where we were doing the isolation, quarantine. We had to find places to ensure that we are doing that. Later on, we realized that we have more patients than the facility. So we said, this works elsewhere, let's employ it here. And indeed, it was working very well with a clear follow-up at home, where healthcare workers designated what we're able to follow up on people and give report. And you are checked from time to time. I want to believe that even when the county is talking about stopping the home-based care, I doubt whether it's still being practiced. Because as much as we hear about that, I know a number of, including healthcare workers, who have tested positive and forced to work because they never exhibited any signs and symptoms. They had mild symptoms. And because of that, it has been happening. And the reason why we were able to do it by then, we were doing what we call contact tracing. You find a severe case, because most of the time, those who present themselves are those which exhibit signs and symptoms, or rather are severely ill. Now, when they come, you check they are positive, you do the contact tracing. Then for those who are found not to have, or rather exhibit any signs and symptoms, were advised to do home-based care with the clear instructions and what was supposed to be done. Remember, we had even a policy that was saying who can do a home-based care and who need to come for quarantine or rather isolation in the facility that we had. Now, in this case, when the county is actually stopping this, I doubt whether it was still being practiced. And if it was being practiced, my question is, what is it that they intend to do differently? Have they now grown the capacity to have everyone who tests positive so that you can be able to quarantine them or isolate them? So, and of course, another bigger issue which we had then was to address the issue where people were even testing positive and hiding from the government because they knew that they would be taken to quarantine or isolation, and at the end of the day, they will be forced to pay. It was causing a lot of anxiety and a stigma to the public. Now, this was to address and make it more friendly to the people so that even when you are called upon to come and do testing, then you just introduce yourself and you don't have to be transferred the cost of being forced for quarantine or isolation, because it is not an easy task. Okay. Because they should be able to cater with some good money. Now, when now the county talk about that, I'm so worried, or rather are waiting to see what is it they want to do differently from where we have come. And of course, I look at it like it's a retrogressive approach to the progress we have made. We only need to strengthen the steps that we have taken and ensure that we are actually implementing the policies that we have put in place, especially on the home-based care, because the question was on that, including all those issues of following up patient and informing, so that we don't put people into... I want to tell you that already we have one of our healthcare worker, public healthcare worker, traveled home without the knowledge. He was sick, he complicated, but he had also infected a parent. Okay. All of them now, they are normal. As we are talking, they are preparing to bury them. This is some of the very severe cases that we normally have, very painful cases that we normally have. So indeed, when we talk about contact tracing, it is a process where you follow up to ensure that the routes of infection are probably controlled and managed. Now, if you start doing it today, actually, I know it is a costly exercise. I do not know where to start, including now, the main county like Nairobi, we are not doing. So it's a worrying trend. Okay.
Now, Njoki, let me bring you here. George says, some of the things that we like are traveling around, somebody just traveled to the village to visit the parents and they got infected. How do we then come about and just, because we had reduced greatly when it comes to infections, but now positivity rate is at 15.4%. Do we go back to lockdown, just locking the country? And how do we balance having locking the country in terms of counties and just ensuring that everybody is safe, and also people like the pandemic and economic impact of all that?
Okay, I don't know about, I'm not sure about the whole lockdown situation, because the lockdown is supposed to manage human behavior, isn't it? So when we say we are on lockdown, that means we are reducing human beings interacting with each other. So when we say we're not having church, we have online ceremonies, is because churches are a way for human beings to interact. When we are saying work from home, and that means we are saying that human beings should not interact in the office. But ultimately, last year during the lockdown, it was a very dark time. It was a very, very difficult time. And all of us, we will always remember those 6-8 months that we stayed at home. And when the children were at home and there was no school and very little was happening, and it will take quite a bit of time for us to recover. But now that we have realized, during that lockdown, we got 2 waves. The first wave and the second wave. By the time now schools were reopening in October, and then after that we got a third wave in December, and the one that we're having now. So this is going to continue, and lockdowns are not sustainable, like we have seen. Yeah, work must continue, life must continue, and we need to eat, we need to live. And so again, the clarion call that I keep talking about, the responsibility of each person. As we are out there not wearing our mask, as we go about our activities, whether in the office, whether we are shopping, whether we are in church, when we're not social distancing, when we're not masking, even if there's a lockdown for 3 weeks or for a month, we will still go back to our bad behavior. So ultimately, it's not helping the situation. So Kenyans really need to be responsible, so that we're able continue with the activities of building the nation, and at the same time, controlling this pandemic.
Okay.
Yeah. In fact, if you look at social media on Monday morning, just look at what guys have been up to. All manner of activities, and they're not wearing masks. So you wonder, okay, so of course the infection rate will increase, and there is no magic around it. It's really just a lot of common sense and a lot of trying to be responsible as Kenyans, because as a medical fraternity, and indeed the government, there is as much as we can do. Even if we put 200 isolation beds, 200 ICU beds in every county, the number will still exceed that if we are careless. You see,
Okay.
Even if we have all the oxygen that we need, it will always be a limited resource. So I'm not sure lockdowns are practical, feasible. I think we just need to change the way we behave.
Okay. You mentioned about capacity. Even if we had enough beds and still the behavior was still the same, we will still go back to where we are. But now, which brings me to my question. George, we had set amount aside funds to deal with this one, just in preparation for that. Did it serve its purpose, if at all, right now we are calling it overstretched?
That is a question that can be answered independently, or rather differently, according to different counties and going by different players. Where I stand, we totally, to some extent, we appreciate some of the counties, but most of the counties, we don't appreciate anything. There is a time we saw in Isiolo, the governor calling people to launch an ICU place. Let alone, we realized that it was nothing, actually nothing existed, because one of us who is a nurse got sick, and there was no place for admission for purpose of oxygen admission. So the patient was airlifted to Nairobi. So up to date, that still is a mirage. Now when Njoki talk about taking individual responsibility, I totally agree. But the individual responsibility is something that must be engraved. That is why we have leadership. If indeed the head cannot turn you to the left, to the right, you'll keep going to the left. What I mean is that there is some of the communication we do that matters. If you tell a Kenyan that you are not supposed to, look at when we started with the dawn curfew issues, everyone was abiding by it. Every instruction that we gave, including ensuring that water points are all over physically, we did that. Including ensuring that most of the people were able to carry around the sanitizers. This is something that is not practiced currently. However, I still see some few points where we still take temperatures and whatever. But of course, as you get to know that less than 3% of our patients now exhibit high fever. Now that's a big worry. But I say we are lucky that we are a young generation, and even the scientific, our ministry modeling research has demonstrated that we are lucky that we have a young population. That it favors a lot, where majority also are not obese. Yeah, this one is assisting us a lot. And that is why most of the people do not seek hospitalization. Now, when we talk about a surge, is where many people seek hospitalization. Now, to the extent where we have more people seeking hospitalization is because they are sick, they can do it to themselves, they need some assistance. And that is why we say we projected what we ought to have done, resources was allocated, and most of the counties misused, and there is audit query to that. And the Kenyan must be able to get to know the kind of leadership that they put in place. And a majority of these people who are in leadership never go to our public facility, get to understand what the healthcare workers are going through to ensure they salvage life through a very strenuous moment where you are manning more than 10 patients, where you are supposed only to man one with even support of other staffs. And then when you do away from that, all of them go to the private facilities where if you today, probably because of your ability to pay the deposit, you'll be able to get a bed at a Nairobi hospital or any other hospital. But for those who cannot, the only place that remains for you is the public facility. Hence the reason to ensure that the policies we put in place, including those that are supposed to build the capacity for infrastructures, ensuring that we have enough staff to offer services, those are the things that we need to do. Now, up to date, when we talk about the issue of including, why I'm pointing about this is about how we don't take things seriously. Up to date, the number of the vaccinated remain around 1%, those who have taken the first vaccination. For those who are fully vaccinated are around 600,000 now. This is after 5 months. Now, all the vaccination are donations. We just did what we call, we had our budget. We even demonstrated that we have allocated enough resources. Up to date, there is no proper arrangement to buy for our own. You know, when you have your own resources you are buying, I don't believe that we will lack. Okay. We will have enough, and we'll ensure that we can be able to channel it down for people to, for the good uptake. Okay. Now, unfortunately, including the people who make decisions now, like let me point out to the politician, majority of them are already vaccinated, a big worry to us. So we need to look at it, and when we continue talking about individual responsibility, the individual responsibility is something that is also reasonable when the leaders do reasonable things. The Constitution, under Article 43, has specifically given the government a responsibility to ensure that every Kenyan can be able to access services, health services of good quality when they so need them. Okay. Is this happening? And that is why we are crying that a patient needs service in Nairobi, you cannot get it. You need to travel several mileage where you are not able to salvage life. Okay. We are actually exposing Kenyan. Okay.
Now, because we are running out of time, Joke, I want to bring you this on as we wind up. If at all we get to probably, the lessons we've learned, are we learning any lessons so that we prepare for any eventuality, probably when we are faced with another pandemic or something? Do we have a manual book that we are recording and saying, this happened, next time when we get to this particular point, this is how exactly we're supposed to be dealing with this?
That would be ideal. That's the ideal situation, that we are actually learning and that we're documenting, so that the next time we have another pandemic, God forbid, then we're able to turn around very quickly. Okay. But then begs the question of our monitoring and evaluation, especially at national level and at county level. Where is all this data sitting? If we are actually collecting data to help us, inform us. Initially when COVID came, we struggled because we didn't know. Okay. But now we have such a huge amount of knowledge, how to deploy facilities, how to hire staff, how to manage counties. We know so much, yeah? How can we use this information in future so that the next time there's another situation, or that this situation keeps repeating itself? Because I know we will have pandemic, wave after wave, then we can deploy the same knowledge. It's something that we need to think about and something that we need to invest in, because then history is not wasted like it has been. One of the very sad things, and this is a controversial area, is how are we collecting data from the patients we are seeing who are sick. In other countries, they're publishing studies, and they're able to tell us, in this population, we gave them this drug and this is how they responded. And soon we'll be having this COVID-19 in medical textbooks to teach our future medical students. Okay. In Kenya, we have so much data, we have so much experience. How much of that is going into publication? Okay. Yeah, so that then we add to the knowledge that there is about COVID-19, specifically for Kenya, and then we can improve this in future. Or are we just wasting? In other countries, even postmortems, when a patient dies from COVID-19, they actually do a postmortem because that body has so much information.
Okay.
So are we doing it in this country, or are we just wasting? We want to bury the person very quickly, but that body has so much information to teach us on how patients are succumbing to COVID-19 and probably help us manage that situation in future. So research then becomes very important, and it's usually neglected because we are so busy treating and looking for oxygen and beds and all these things. But then research then informs the future, and I think it's very important that we get into this. Yeah. Okay.
Now I'm totally out of time, but I just wanted to touch on something, if my director will allow me, just 30 seconds of each of you. The vaccine. How should we go about administering this vaccine so that, and also just shortest time possible, 30 seconds, so that everybody that is supposed to take these vaccines actually takes the vaccine? Njoki, I'll start with you as we wind up. I've finished. 30 seconds at most.
So, like I said earlier, there's vaccine inequality, there's vaccine shortage, and this is an international conversation, not only in Kenya. I agree with what George had said earlier, that in as much as we're looking for donations, we should honestly invest some money into procuring vaccines for our people. That is one thing. And then there's also the thing of vaccine hesitancy. So when the vaccine is made available to those people that it is made available to, we need to avail ourselves of vaccination. We saw in the first round when the vaccine came, even we medical people were hesitant to go for the vaccine. And then the general public are the ones who went, and then there was that crisis of the shortage and everything. And I believe that if Kenyans were not vaccinated, we would be in a worse off situation. I don't have the data to prove that, but I'm very convinced. So two things. That one, let the government really go out of its way to procure vaccines. Number two, the private sector should be allowed with regulation to import vaccines, because there are those people who probably wouldn't mind paying for it, so that they get vaccinated. So are we able to come up very quickly with guidelines to facilitate the private sector to help us get as many people vaccinated as possible? And then when the vaccine comes, let us avail ourselves for vaccination. Let us stop the rumors. Let us stop the sideshows that really make people afraid. Then the uptake of the vaccines will be good, and then we will help the situation. Okay,
I'll have to cut you there. George, 30 seconds at most.
Yeah, thank you very much. That's a very important question, and actually I will put it like a way forward. The only way to fight any pandemic is to ensure that you vaccinate close to 60 to 70 of your population. Targeted population. And to this extent, I was talking about we are doing less than 1% fully vaccinated. Now, after 5 months, there's a projection, country projection, to do 24 million next year, June. Now, what do we need to do? We still have inequalities, and of course, as Njoki has said, we can be able to say what has been the attributing factor to that very low. It is because of lack of the vaccination. Now, even when there is, we have not done the sensitization. This is not the only first vaccination we have in the country. We are doing more other than even 5 vaccination in the country. Like currently, there have been polio vaccination campaign that have been going on. And the uptake has been good. So we do not expect, if we package the information very well, do the sensitization, it will not be low. And the last thing is that let us expand. Let us allow all that have the capacity to do it, including the government facility. We are still restricted to very few. Like here in Nairobi, the points for vaccination are very few. Let's expand. Lastly, on that expansion, what I'm trying to say is that the US, currently we have close to 15 types of vaccination. The US employed more than 5 vaccination to be used in the country. Now we are still restricted to AstraZeneca. Yes, we are happy that Pfizer is now being welcomed through the Pfizer company in the country. They can be able to bring it in. But what happened to others which we can be able to approve, because they are being used elsewhere. So let's.
We value